abusia Ghana mampani His Excellency John Dramani Mahama wabe pie ha Korle Bu Teaching Hospital ha na baby a Cardiothoracic Centre ɛhɔ ɛna wɔn timi eyi akoma to hɔ papa mu ɛhwɛ sɛ mfomso bi omu a wɔn timi ahyehyɛ asan asiesie ɛhɔ ɛna wabe pie na wɔba ha na the Cardiac Catheterization Laboratory a wɔn asi no sonko ɛwɔ ha sei ɛna wɔba no wabe bia no na wɔba wɔne Minister of Health Yera Kwabraminta Kando and Penifua Hodo Mami Obo Biadako Mrs. Ekanidin ho wono ena woye penia wada eye Mahama Care ye Ghana Medical Trust Fund hano womu nyinaa e wa ha bia busuane e course wa hano Ghana News TV nana Sefa ni bobo mabomode aba ibetwa na mamanya bia hwe ne manya bia tie mesro se ne ndi kan wa ba hwe me a subscribe na share video yi e mame na emo manfo so my Ghana your health sector no yegusua improve na sa center yi ade a ebema manfo kwan ama so obi nya cardiac arrest your friend heart attack na won betimi apapa no abie na akoma mu se ho behia se LC edi robot bi hyemu etimi bua no manitimi home a etimi aboa no won so a na wo home o mo bre nyina no ebetimi aboa mo mapai na wo matimi aye surgery na so operation stronko hia se ebe fly nipa no de na kopi mo India ama yatimi as operating abusia ebeboa amomanfo atimi atena nkwamu adi omo nkwa amen na omo anko omo nkrachi enam akomamu yade nti abusia na yekoso ha nyina no Ghana News TV yenkwe ni nti
Thank you very much, the National Cardiothoracic Centre, QA.
Standing on all protocols, I want to say good morning to all of you. Every nation in its journey will face a moment that tests not its resources, but its resolve. Today, Ghana answers that test. Your Excellency, we are gathered to restore a lifeline, to reclaim a critical pillar of our national health security, and to affirm in the clearest possible terms that in this republic, we do not abandon what saves lives. This occasion is defined by a profound consistency in leadership. On the 4th of July, 2017, on this very ground, you, Your Excellency, commissioned the initial Cardiac Catheterization Laboratory. That singular act was a declaration of intent that Ghana would no longer outsource cardiac survival, that Ghanaian expertise, given the right tools, could deliver world-class outcomes right here at home, and it did. For 8 solid years, this Cardiac Catheterization Laboratory became a place where time was returned to families and where emergencies were reserved until the 7th of January 2025. The fire that consumed this facility was not merely an infrastructural loss, it was a clinical emergency that significantly disrupted the Korle Bu Teaching Hospital's capacity to provide life-saving cardiac interventions. It interrupted the continuity of care for cardiovascular disease, now the leading cause of mature mortality in Ghana. It placed our clinicians in an untenable position and our patients in a life-threatening one. A nation's character is not revealed in the moment of loss. It is revealed in the moment of response. When the Ghana Medical Trust Fund visited this site on the 13th of January 2026, our mandate was clear, established by your administration to address the devastating burden of chronic non-communicable diseases, our responsibility is twofold: to provide financial protection for patients and to build the resilient systems that protect all patients. We saw not just what had been destroyed, but what the future demanded. We resolved that we will not merely restore, we would expand and elevate. On the 17th of February 2026, reconstruction commenced. Today, less than 5 months later, we deliver on that resolve. What we inaugurate here today is not a replica of what was lost. It is a superior successor, fully reconstructed, technologically upgraded, and significantly expanded in capacity to meet current and future demand. It is faster, safer, more advanced than its predecessor, and it has been delivered with urgency, transparency, and technical excellence. Therein lies the deeper significance of your presence here today. 9 years ago, you lit this light. Today, you relight it brighter and stronger. Your Excellency, in the history of public service, few leaders are granted the rare privilege of both initiating a transformative national investment and returning to restore it after adversity. Your presence today is therefore symbolic. It represents continuity of vision, compassion, and commitment to the Ghanaian people. Behind every cardiovascular statistic in this country is a Ghanaian's life or Ghanaian's life interrupted. Behind every delayed intervention is a family thrown into financial and emotional crisis. Your Excellency, perhaps the clearest testament to the value of this investment is that even before this facility officially resumes full operations, it is already creating opportunities to save lives. In collaboration with the National Cardiothoracic Centre, specialist cardiologists from the United States, the Mount Carmel Foundation, Africa World Airlines, and the Ghana Medical Trust Fund, this reconstructed cath lab will serve as a centerpiece of a landmark program to undertake complex cardiac implantable electronic device procedures for initial 30 patients selected from across Ghana, starting from Sunday, the 12th of July, 2026, to Friday, the 17th of July, 2026. This cardiac catheterization laboratory is indeed our answer. It is where science meets compassion, where expertise meets equity, where a family from any part of this country can have their blocked artery opened, their heart rhythm restored, and their life returned to them with dignity. This is the sacred work that resumes today. Your Excellency, this inauguration is Ghana Medical Trust Fund in its purest expression. It demonstrates that our trust fund is not simply a financing mechanism, but a nation-building instrument. We are here to pay the bills of the vulnerable, yes, but we are equally here to train the specialists who will diagnose and treat them, to build the facilities that will heal them, and to fund the research that will protect the next generation. This is only the beginning. As we replicate this model of strategic infrastructure investment across the country, we are laying the foundation for a Ghana where no citizen is denied life-saving care because of where they live or where they can afford it. Allow me, therefore, to express our profound appreciation to His Excellency, President John Dramani Mahama, for the transformational leadership and for entrusting us with this critical national mandate. Your Excellency, distinguished guests, in the weeks to come, the speeches of today will fade from memory. What will endure is what happens within these walls. It will endure in the quiet relief of a family told that their loved one will live again. It will endure in the renewed confidence of a Ghanaian cardiologist who knows he or she can now offer his patients the very best the world has to offer, right here in the Korle Bu Teaching Hospital. This is our legacy. That is our measure of success. Today, we reaffirm a promise that the Ghana Medical Trust Fund will protect every equipment in this place, that Ghana will protect her people, that Ghana will invest in life, and that Ghana will never allow adversity to have the final say. May this catheterization laboratory stand for generations as a monument to resilience, a citadel of excellence, and a sanctuary of hope. May God bless the Korle Bu Teaching Hospital. May God bless the Ghana Medical Trust Fund. And may God bless you, His Excellency, the President of the Republic of Ghana and our homeland. And once again, I want to say thank you to all of you, but never forget that truly Mahama cares. Thank you.
Thank you very much, Madam Obuobi, Administrator of the Ghana Medical Trust Fund. Your Excellency.
For the Ministry of Health, today is important because it marks the translation of policy into service delivery. It is one thing to recognize the growing burden of cardiovascular disease and other non-communicable disease. It's another thing to put in place the infrastructure, equipment, financing arrangement, and clinical capacity required to respond to that burden in a meaningful and a sustainable way. This facility, therefore, represents more than an investment in the catheterization laboratory. It represents an investment in the ability of our health system to offer timely, specialized, and life-saving interventions to patients who, in the past, may have faced long delays, expensive referrals, or limited treatment options. Ladies and gentlemen, the burden of cardiovascular disease becoming increasingly evident in our hospitals, clinics, and communities. Hypertension, heart disease, stroke, diabetes, kidney disease, and other chronic conditions are no longer distant or occasional health concerns. They are now part of the daily reality of health delivery in Ghana, affecting people in their productive years, placing pressure on families and imposing increasing demands on our health facilities. This changing burden of disease requires us to organize the health system differently. At the primary level, we must strengthen prevention, screening, early detection, health education, and continuity of care. At the specialist level, we must improve access to advanced diagnostics, modern equipment, trained personnel, and timely interventions. And this is exactly what we are doing. This is a practical link between the free primary healthcare program, the National Health Insurance Scheme, and the Ghana Medical Trust Fund, popularly known as Mahama Cares. The Cath Lab is therefore a practical example of the new direction of healthcare delivery. It recognizes that financial support alone is not enough if the service is not available. It also recognizes that equipment alone is not enough if the system does not have trained professionals, proper maintenance arrangement, referral pathways, and sustainable financing to keep the service running. With this facility, the National Cardiothoracic Centre will be better positioned to provide advanced diagnostics and interventional cardiovascular services, including cardiac catheterization, peripheral vascular procedures, and neurovascular interventions. These services will improve the management of heart disease, vascular conditions, and acute stroke, while reducing the need for some patients to seek care outside Ghana. The importance of timely intervention cannot be overstated. In conditions such as stroke and acute cardiovascular disease, Time can determine whether a patient survives, whether disability is prevented, and whether a family is spared the social and economic consequences of illness and its catastrophic cost. For the Ministry of Health, our responsibility is to ensure that this investment delivers its intended impact. We must ensure that this lab is properly integrated into the wider referral system, that patients are identified and referred early, that clinicians are supported to provide safe and quality care, and that the equipment is maintained to the highest standard. We must also ensure that this facility becomes a platform for capacity building. Specialist infrastructure must go hand in hand with specialist training. The ministry will therefore continue to work through the Ghana Medical Trust Fund Mahama Cares, Korle Bu Teaching Hospital, the Ghana College of Physicians and Surgeons, and other relevant institutions to strengthen the training of specialist doctors, nurses, biomedical engineers, technicians, and allied professionals required to support advanced cardiovascular services. Ladies and gentlemen, sustainability must remain at the center of this investment. A modern catheterization laboratory requires more than commissioning day excitement. It requires discipline management, proper maintenance planning, reliable consumables, trained biomedical support, efficient scheduling, and clear clinical governance. I therefore urge the management of Korle Bu Teaching Hospital and the National Cardiothoracic Centre to operate this facility with the highest standards of accountability, patient safety, and efficiency. I also wish to emphasize the importance of collaboration. The success of the facility will depend on strong coordination among the Ghana Medical Trust Fund, Korle Bu Teaching Hospital, the National Cardiothoracic Centre, the Ministry of Health, the National Health Insurance Authority, and other relevant agencies. Our objective must be to ensure that the patient does not experience these institutions as separate offices, but as one coordinated health system working in his or her interest. I commend the Board of Trustees, management, and staff of the Ghana Medical Trust Fund for bringing this important project to fruition. I also acknowledge the leadership of the administrator, Madam Adjoa Obobia Dako, for the energy and focus she has brought to the establishment and early implementation of the fund's mandate. Within a short period, the fund has moved from concept to tangible intervention in patient support, specialist training, and specialized infrastructure. I also commend the leadership of Komfo Teaching Hospital, the National Cardiothoracic Centre, our distinguished health professionals, contractors, engineers, biomedical personnel, and all partners whose work has made today possible. Facilities such as this succeed because the dedication of the people who design them, manage them, maintain them, and use them every day to save lives. Your Excellency, on behalf of the Ministry of Health, I assure you that we will continue to provide the policy direction, coordination, and oversight required to ensure that this center delivers real value to patients and to the health system. We will also continue to work with the Ghana Medical Trust Fund and other institutions to expand access to specialized care in a manner that is orderly, sustainable, and equitable. As we have commissioned this center today, let us commit ourselves to making it a place of excellence, compassion, efficiency, and hope. Let it be known not only for the sophistication of its equipment, but for the quality of its care, the professionalism of its staff, and the lives it will save. Finally, I cannot sit down without acknowledging the man who dreams and executes, and in the course of the execution, he will follow the fine details and provide support. The man who, when there is a problem, will think about the solution. The man who has made this vision a reality. At this point in time, join me, appreciate His Excellency John Dramani Mahama, the President of the Republic of Ghana. Your President, our President, and my boss. Thank you.
Thank you, Mr. Minister. His Excellency John Dramani Mahama to deliver the keynote address. Your Excellency.
Thank you very much. Thank you. Kindly be seated. Thank you very much. Let me proceed on established protocol and just say, distinguished guests, ladies and gentlemen, when the administrator of the Ghana Medical Trust Fund was reading her speech, she said something that caught my attention. She said, the Ghana Medical Trust Fund is not simply a financing mechanism, but it's a nation-building instrument. When we conceptualize the Medical Trust Fund, at first our attention was on the costs that patients had to bear to treat non-communicable, diagnosis and treatment of non-communicable diseases. But with time we realized that it was not only about financing diagnosis and care. Even when you accepted to finance a patient, there was no facility available in the vicinity where the patient was to be able to diagnose and care for the patient. And then aside from that, it's not just financing the treatment and care, it's not just providing the equipment for diagnosis and treatment. The next thing we realized also was you need skilled critical care professionals to be able to use those equipment and those facilities to be able to provide quality health care to these patients. And so it's expanded the mandate of the Ghana Medical Trust Fund, not only to fund diagnosis and treatment for patients, but also to provide the facilities for such treatment to take place, and then also to ensure that there are skilled personnel to be able to provide diagnosis and care for these patients. And so this is part of the mandate of the Ghana Medical Trust Fund that we are covering. The trust fund was allocated 2.3 billion cedis, and it is using part of that money to provide financing for diagnosis and treatment. But it's also using part of that financing to ensure that, notwithstanding which part of the country you are, you can have access to diagnosis and treatment. And so this is why we are here today. The effort to provide skilled professionals has also begun with the first nursing training facility here in Korle Bu to train critical healthcare nurses in nephrology, in cardiovascular issues, in oncology, and all the other important critical care areas. The next center will be in Korle Bu Teaching Hospital. And so far, Cabinet has given approval for 500 of these nurses to be recruited and trained. I think the nurses in Korle Bu have already been matriculated and are beginning their courses. And once they finish their courses, they'll be sent to these centers for treatment of non-communicable diseases, so that we'll have the professionals, we'll have the facilities, and also we'll have the ability to finance the diagnosis and treatment. But we are also learning from something. When I was vice president to Professor Tamils, we spent about $250 million to retool all the major regional and teaching hospitals in this country, provided CT scans, MRIs, X-rays, and all the major equipment that was needed. A few years after that, we found out that most of that equipment was not properly maintained and had broken down, and the hospitals were calling on government again to do another retooling or replace the equipment. It is not a sustainable model. And so we've established a different model for this retooling that we're doing. And so Cabinet has approved the Ghana Medical Equipment Services Limited, which will be a subsidiary of the Ghana Medical Trust Fund. These will be specialized biomedical engineers who will oversee and supervise the use and maintenance of the equipment. And they will be the vehicle if the equipment is obsolete or is broken down beyond repair and has to be replaced. Is the Ghana Medical Equipment Services Limited that will be responsible and be the vehicle for replacing the equipment. We believe that this will be a more sustainable level, so that the investment the Ghanaian people are putting in will not just go to waste like it has done in the past. So these are just a few comments I wanted to make, but I have a short speech here, so if you just be patient, I'll inflict it on you and then we'll be out of here. It's a great honor to join you today for the commissioning of the Ghana Medical Trust Fund Cardiac Catheterization Laboratory at the National Cardiothoracic Centre of the Korle Bu Teaching Hospital. This is another important milestone in our collective effort to build a healthcare system that is equitable, that is resilient and responsive to the changing health needs of our people. It demonstrates our unwavering belief that every Ghanaian, regardless of income, geography, or social status, deserves access to quality health care. The true wealth of any nation lies in the health and well-being of its people. Healthy citizens are more productive, children learn better, families thrive, businesses flourish, and nations prosper. Every investment we make in healthcare is therefore an investment in Ghana's human capital and in the future of our country. It is this conviction that underpins the comprehensive reforms we have initiated within our health sector. In recent years, Ghana's disease profile has evolved considerably. While we continue to make progress in combating infectious diseases, we are witnessing a rapid increase in non-communicable diseases such as cardiovascular diseases, strokes, cancers, kidney failure, diabetes, and hypertension. These illnesses now account for a significant proportion of premature deaths and long-term disability in our country. Beyond the medical challenges they present, these diseases often impose enormous financial burdens on the households that have these patients. Too many households have exhausted their savings, sold valuable assets, or abandoned treatment altogether simply because specialized healthcare was beyond their financial reach. No responsible government can ignore this reality. And so it was precisely to address these challenges that we introduced two transformative initiatives. First, the free primary healthcare program and the Ghana Medical Trust Fund. The free primary healthcare program focuses on prevention, early diagnosis, and timely intervention at the community level. It seeks to ensure that diseases are detected before they become life-threatening, and that every Ghanaian has access to essential healthcare services regardless of their financial circumstances. The Ghana Medical Trust Fund complements this effort by providing financial support for specialized treatment while simultaneously investing in infrastructure, equipment, research, specialist capacity training required to deliver world-class healthcare. So together, these initiatives represent a new philosophy of healthcare delivery, one that places the patient at the center while strengthening the institutions that provide care. These two initiatives, together with the National Health Insurance Scheme, we believe are the answer to providing universal health coverage for our people. Our vision is clear. We must build a healthcare system that prevents illness where possible, treats diseases promptly when they occur, and ensure that specialized care remains accessible and affordable for every Ghanaian. Today's commissioning is tangible evidence that this vision is within reach and is becoming a reality. One of my final duties before I left office in 2017 was to commission a new cath lab right here in Korle Bu Hospital, following a petition I received about the lack of this critical piece of equipment at the nation's premier teaching hospital. For almost a decade, this new cath lab transformed cardiovascular care in Ghana. And as Dr. Ntuamensa said, it enables thousands of patients to undergo life-saving, minimally invasive procedures without having to travel abroad. The unfortunate fire that destroyed that facility in March 2025 represented a significant setback for our health system. It disrupted services, it increased pressure on our clinicians, and placed additional burdens on patients and their families. Today, however, we celebrate not merely the replacement of what was lost, but we celebrate the creation of something even better than what we lost. So this new cardiac catheterization laboratory represents restoration, renewal, and progress. It reflects our determination that setbacks should never define our future. Instead, they should inspire us to rebuild stronger, smarter, and better than before. The advanced technology that has been installed here will significantly improve Ghana's capacity to diagnose and treat complex cardiovascular conditions, including coronary artery disease, structural heart disease, peripheral vascular disease, and other life-threatening illnesses. Equally important, this facility will enhance our ability to provide timely neurovascular interventions for stroke patients, where every minute saved can mean the difference between full recovery and permanent disability. Each successful procedure carried out here will represent more than a medical achievement. It will mean another patient returning home to his family, another worker returning to productive employment, another young Ghanaian given a second chance to pursue their dreams. That is the true value of investing in healthcare. This facility is not an isolated project. It forms part of a broader national strategy to strengthen specialized healthcare across Ghana. Through the Ghana Medical Trust Fund, the government is investing in establishing 2 new comprehensive cardiology centers at the Komfo-Anokye Teaching Hospital and the Tamale Teaching Hospitals. These centers will bring specialized cardiovascular care closer to millions of Ghanaians in the middle and northern belts of our country. Healthcare should never depend on where one lives. Every citizen deserves equitable access to quality specialist services. And I'm very happy Dr. Instrumenta said they are going to mentor these two new younger brothers of theirs. Thank you very much. Upon completion, these facilities will offer comprehensive cardiovascular care, incorporating modern diagnostics, imaging, intensive care units, specialized consulting suites, laboratories, pharmacies, oxygen systems, and other advanced support infrastructure necessary to deliver integrated patient care. Collectively, these investments will position Ghana as a leading center for cardiovascular medicine in West Africa, reducing reliance on medical tourism, strengthening specialist training, and advancing research and enhancing our capacity to respond to increasingly complex health challenges. Unfortunately, this equipment arrived too late to save Dr. Kwame Edu Ofori, a skilled emergency physician at the Komfo-Anokye Hospital who suffered a myocardial infarction. And for those of you who don't know, a myocardial infarction is a heart attack. I've been learning, you know. Dr. Sribo is my supervisor. And he died because there was no functioning cath lab to open the blocked blood vessels in his heart. His death triggered the urgent need to replace the cath lab in Korle Bu with this important critical care equipment we have just commissioned today. I'm pleased to report, and I've said it already, that we're also installing 2 new cath labs in Komfo-Anokye and Tamale Teaching Hospitals. And plans are also advancing for the installation of similar facilities in Efiang Kwanta Hospital in Takrady and the whole teaching hospital in the Volta region. Dr. Kwame Edu Ofori's death must not be in vain. These new critical care equipment will not only save Ghanaian lives, but also eliminate the need to travel abroad for such medical procedures. The Ghana Medical Trust Fund is also poised to provide critical equipment to enhance treatment of cancers, renal diseases, both here in Korle Bu and in other hospitals across the country. But none of these achievements will be possible without the dedication of our healthcare professionals. To our doctors, nurses, pharmacists, biomedical engineers, laboratory scientists, technicians, and support staff, I express the profound gratitude of the government and people of Ghana. While modern equipment is indispensable, it is your skill, your compassion, and your professionalism that ultimately will save lives. I also commend the Board of Trustees and Management of the Ghana Medical Trust Fund, the Ministry of Health, led by Akwadanyame, the management of the Korle Bu Teaching Hospital, the National Cardiothoracic Centre, the contractor, Mr. Diaz and his team, and all who contributed to bringing this project to fruition. As we celebrate this achievement, let me also emphasize an equally important responsibility. We must maintain these facilities to the highest standards. Ghana has on too many occasions invested substantial public resources in valuable infrastructure only to see those investments deteriorate due to neglected maintenance. And that's why I just announced the setting up of the Ghana Medical Equipment Services Limited. Building a world-class healthcare system is not the work of a single government or a single institution. It is a continuing national responsibility. Government remains committed to expanding healthcare infrastructure, strengthening our health workforce, investing in medical technology, and supporting research and innovation, and ensuring that quality healthcare becomes increasingly accessible to every Ghanaian. And so let history record that this generation chose to invest not only in roads, bridges, and buildings, but also in the health, dignity, and future of our people. Long after today's ceremony has ended, the true significance of this facility will be measured not by the sophistication of the equipment, but the countless lives it will save, by the families it will keep together, and the hope it will restore to a grateful nation. But before I close, let me also announce that we're going through the procurement process to build a new maternity block for the Korle Bu Teaching Hospital. And we will pull down the old Gordon Guggisberg building that has today become a death trap. Every other day, our mothers give birth in that building. It is a death trap that can cause devastation. And so, it is now my singular honor and privilege to declare the Ghana Medical Trust Fund Cardiac Catheterization Laboratory at the National Cardiothoracic Centre of the Korle Bu Teaching Hospital duly commissioned for the service of the people of Ghana. I thank you. May God bless the Korle Bu Teaching Hospital. May God bless you all. May God bless our homeland, Ghana, and make our nation great and strong.
Another round of applause. Thank you, Your Excellency, for your inspiring address. And thank you very much.
Warriors here, this is gungulum 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 Gung Ghana News TV. The time is 6 o'clock. Let me follow.
Menu makwekwe is asempa kania. Semenam na meti asempa na mamo amania na mano kekame. Anyambia wati ANS Trading Agency Limited nka. Sa woka say door to door for no de ani wetwa. E sense wo bia no wa say one was door to door business nim. Wo nneoma wo UK a wo de kwa Ghana. Ana say Germany a wo de kwa Ghana. 3 to 5 weeks ebekwa kodu nipa ne puna no say try. Na de mo demonstration ko say adwuma de we mu ne say wo mo bo no. E da form say boko. ANS Trading Agency Limited. E wo air freight special service. And nneoma no ye de be fa plane. Entintempa na akwa Obetima for South Korea, we also the new free Ghana, Aqua UK, and Germany. FAGG them, which are also a year, I mean drop a bomb. ANS Trading Agency Limited pair, and a 40-footer, any 20-footer container. FA UK, Edico Ghana, and Germany, Edico Ghana. Oma Manio Mayame, import to, export to, them there for you. Omo Ghana Namani, 0249 170 423. UK has over Freya 0790 802 7527. Germany 09173 771 2733. Ubenya ANS Trading Agency Limited. Our West Croydon ANS Trading Agency Limited. Quantum Brantem. Wana beboya baso. Maybe next time in your fill up from the bebro.